Good evening, everyone, and welcome to the SADA and NICORETTE webinar on smoking cessation, presented by Jackie Maimin. I'm Elani van Zyl, the Divisional Scientific Lead for Kenvue South Africa, and it is a pleasure to have you with us tonight as we spotlight the importance of smoking cessation during Stoptober, a national campaign that encourages smokers to quit for 28 days, significantly increasing their chances of quitting for good. I'm truly honored to introduce our speaker to you tonight, Jackie Maimin. She graduated with distinction from Rhodes University and has dedicated her career to the community pharmacy sector. She served for 10 years on the South African Pharmacy Council, chairing the Practice Committee, and was recently appointed by the Minister of Health to the South African Nursing Council to advise on medicine-related matters. Currently, Jackie is the CEO of the Independent Community Pharmacy Association and a fellow of the Pharmaceutical Society of South Africa. Her insights and leadership continues to shape the future of pharmacy, of smoking cessation, and healthcare in South Africa. So let's dive in. Over to you, Jackie.
Thank you so much, Elani, for that very warm welcome. And it is me that's honored to be talking tonight to the dentists out there. And thank you very much for the opportunity. I'm going to share my screen. And Elani, can you see my screen?
Yes, Jackie, it is visible.
Fantastic. So tonight I am going to be talking about Stoptober and smoking cessation. And you'll see we have called it NICORETTE. Now, normally when I do presentations, I don't use trade names. But in terms of nicotine replacement therapy, NICORETTE is the only brand in South Africa. So I'm quite safe to use the brand names. Right. Let's move swiftly on. So tonight, I'm going to take you through the burden of smoking, the role that healthcare professionals can play in helping people to quit. We'll talk a bit about the components of cigarette smoke, why nicotine is so addictive. I'm going to do a section on nicotine replacement therapy, the benefits of quitting, and then, of course, the national campaign. It's an international campaign called Stoptober. So there is a webinar poll on your screens at the moment. If you could just answer that, and we will get the results a little bit later. All right, so executive summary. Smoking is a real chronic disorder characterized by the development of an addiction status, mainly due to nicotine. Smoking is the leading cause of preventable diseases. That's cardiovascular, pulmonary, and of course, cancers. Medical schemes lack a structured smoking cessation benefit. Dentists and oral hygienists play a crucial role in identifying smokers, informing of the risks, and recommending smoking cessation. And pharmacists can play a crucial role in smoking cessation interventions, which I'm going to show you as we go along. So the proposal is to introduce an evidence-based stop smoking service covered by funders and recommended by healthcare professionals. This, of course, aligns with NHI and preventative healthcare. So if we're looking at the global burden, and I pulled these statistics off the WHO website, there are over 7 million deaths annually due to tobacco use. That's globally. If we look at deaths related to smoking exposure, secondhand smoke exposure, there is a further 1.3 million deaths. Across the globe, there are 1.25 billion people that smoke, and 80% of those are in low to middle income countries such as ours. The interesting thing is that research shows 60% of smokers want to quit, but that 70% of them have no access to stop smoking support. And of course, that access is really predominant in the LMICs, the low to middle income countries. So if we now go to GATS, South Africa, the prevalence of tobacco and electronic cigarette use by age among adults aged 15 years and older is shown in a survey from 2021. So the orange are cigarette smokers, the gray is hookah or bubbly or, the pipes. Electronic cigarettes is the yellow, and the blue is smoked tobacco. So you can see there's a lot of people sitting in the 45 to 64 age group, but there is still an alarming number of youngsters that are smoking. And the first graph shows you the overall smoking status here in South Africa. We're sitting at 25, almost 26% of South Africans are smoking. So the impact of smoking, we usually look at the non-communicable diseases, and they are major risk factors to various non-communicable diseases. And in fact, 14% of all NCD-related deaths of adults aged 30 years and over are attributable to tobacco use. And tobacco cessation significantly reduces the risk of various diseases, particularly amongst the NCDs, such as diabetes, cardiovascular disease, cancers, and chronic respiratory diseases. So if we go and look at the research, and you can see at the bottom there are my references. We know that smoking is a real chronic disorder characterized by the development of an addiction status, mainly due to nicotine. This condition makes the smokers generally unable to quit smoking without help. Smoking reduces the quantity and, above all, the quality of life. And in fact, it's been shown that a smoker's life expectancy is on average 10 years shorter than a non-smoker, and that half of the smokers lose about 20 years of healthy life before dying because of a smoking-related disease. Smoking cessation strategies should be implemented in every clinical context. So as dentists, what can the dental profession see? So here's an example, and I apologize, it's a little bit blurry. This is a 64-year-old male with a long history of cigarette smoking. And you can see here an asymmetrical nodular mass in the retromolar region. And the diagnosis for this man was squamous cell carcinoma. Here are some more. If we look at the one on the right, you'll see a red and white surface alteration, which is centrally indurated. And this was noted in a 70-year-old male patient, also with a long-time history of tobacco and alcohol abuse. The middle one shows a densely papillary white exophytic mass with posterior ulceration. And this was a 72-year-old male with a 55 pack per year history of cigarette smoking and heavy alcohol consumption. And lastly, the one on the right, a 78-year-old woman with a long history of tobacco and alcohol abuse. And she presented because she was having difficulty opening her mouth. On examination, it revealed a foul-smelling lesion extending superiorly and to the posterior. And all of these were diagnosed as squamous cell carcinomas. You as dentists, of course, will see people long before they get here. And that would be with staining, especially in your heavier smokers, or receding gums and gingivitis. So do you smoke? I mean, we all know the jokes with dentists. You ask us questions while we've got our mouth full of gadgets. So this is a question you should be asking every one of your patients when they come in. And if I could ask for the poll to be shown, you'll see here, this is I'm so happy, 2/3, 68% of you do routinely ask your patients whether they smoke. And I'm hoping by the end of tonight, the other 32% will be. And I see as well that you're very comfortable about referring a smoker who wants to quit to somebody who can provide smoking cessation support. So thank you very much for that. So you've got to ask yourself, what is our role? So the first thing is smokers expect to be asked about their smoking habits by healthcare professionals. And I think this is the first thing we can do, is routinely ask people about their smoking status. Then there are a few simple messages that clinicians can and should communicate to all of their patients. So number one, don't smoke. Number two, if you do smoke, there are major health benefits to stopping as soon as possible, no matter what your age or how long you've been smoking. And then thirdly, and this is the important one, a wide array of effective cessation treatments are available. So our role is to save lives. And the amazing thing is that one premature death will have been avoided with every 2 smokers a healthcare practitioner persuades and helps to stop smoking. I mean, those are just, it's amazing statistics. We were just talking the other day that if tobacco was discovered today, SAPRA would never allow it to be released. It really is the only chemical where if you use it exactly as you should, kills half its users. So let's look at number needed to treat, or the relative effectiveness of different health interventions. We all know about statins and cholesterol. So statins have a number needed to treat of 60 to prevent a heart attack and 268 to prevent a stroke within 5 years. And yet we all know that people go onto statins as soon as their cholesterol is elevated. If we look at number needed to screen and we look at cervical cancer, 1,140 pap smears need to be done to prevent 1 death over 10 years. And yet we routinely recommend pap smears for women. Now let's look at smoking cessation. So here, an intervention as simple as brief advice. 80 people given brief advice on smoking cessation, you will have prevented 1 premature death. And you can go on, you can add pharmacological support such as nicotine replacement therapy, and the numbers come down. Add behavioral support, the numbers halve. And I've already mentioned that for every 2 people that quit, you save 1 life. So let's talk a little bit about cigarette smoke. So tobacco smoke contains about 4,000 different chemicals, but the 3 main ones that we need to focus on are carbon monoxide, hydrocarbons or the tar, and of course nicotine. So carbon monoxide, we all know about carbon monoxide poisoning. It is a clear, odorless, tasteless gas. It binds to hemoglobin. It attaches the same site on the heme molecule that oxygen normally binds, but with a much higher affinity, and it effectively displaces oxygen, preventing it from being transported around the body, and hence smokers get out of breath very easily. It increases plasma viscosity and fibrinogen levels, making the blood thicker and stickier and more likely to form clots. This forces the heart to work much harder, leading to the cardiovascular effects. And smoking during pregnancy prevents the fetus getting the oxygen it needs, leading to low birth weights and premature births. So let's move on to hydrocarbons or tar. It's the tar that is the main carcinogen. 70% of inhaled tar is retained in the lungs, where it has a direct effect on the lung function. The first thing it does is it inhibits the ciliary action. So smokers can't get mucus out of their lungs or the tar, and hence you get that hacking cough in the mornings because the cilia are just not working properly. The volatile hydrocarbons also have a significant effect on the metabolism of some prescribed medicines. Interestingly enough, a lot of the antipsychotics are affected by smoking, and we do find that patients with mental disorders tend to smoke. Low tar cigarettes are no safer than high tar cigarettes. because very often the person compensates by smoking more frequently and inhaling more deeply. And a study by the American Cancer Society found that the use of filtered low-tar cigarettes may be the cause of adenocarcinoma, a particular kind of lung cancer. And then the third component, the nicotine. This is an alkaloid. It's part of the nightshade family. It constitutes approximately 0.6 to 3% of the dry weight of tobacco. It's widely used as an insecticide. In fact, I use tobacco dust to keep snails off my veggies. In low concentrations, and an average cigarette yields about 1 milligram, the substance acts as a stimulant in mammals. So on one side, you can use it as a pesticide, and in low doses, it's a stimulant. And it is the main factor responsible for the dependence-forming properties of tobacco smoke. And just interesting to note here, this comes from the American Heart Association. Nicotine addiction has historically been one of the hardest addictions to break. So let's see, why is nicotine addictive? So here, number one, you can see smoking delivers nicotine. Within seconds, it travels to the brain. In the brain, it causes dopamine to be released, leading to that feeling of pleasure and calmness. And you'll hear so many smokers say that they smoke to relieve anxiety. But unfortunately, it has a very short half-life. And within minutes, it starts to drop. You get withdrawal and you get symptoms of irritability and stress, and hence the desire for another cigarette. So if we look on a scale of addictiveness, you'll see here that nicotine is right at the top. Now, this is not to say that smoked methamphetamines don't destroy lives, because they do. They absolutely do. This is showing you the difficulty to come off a particular product, and nicotine is notoriously difficult to come off. What are the key signs of addiction? So number one, obviously, continued use despite knowledge of harmful effects. I once had a young lady, and I was trying to help her stop smoking. And she said to me that sometimes at night, she was a chronic asthmatic. And she said, I'd wake up at night and my chest would be tight, and I'd use my inhaler. And then while I was waiting for my chest to open up, I would smoke. And that just shows you, it's just crazy. You continue using it even though you know it's bad for you. Craving during abstinence, so that withdrawal. Failure of attempts to stop. So research shows that the average smoker will try and stop smoking 7 to 8 times before they are actually successful. Then the withdrawal symptoms during abstinence, and very often the first withdrawal ones are irritability, and then compulsive use, where you literally, you see people getting off the plane and they go straight to the smoking section to get their nicotine levels up. If we look at the possible mechanisms, the research shows that it's probably related to both its positive and its negative reinforcing actions. The drug reinforces the behavior, and the behavior reinforces the drug. And smoking is a complex psychopharmacological condition. Some people are highly addicted to the nicotine. Others can be addicted to the habit, the picking up of the cigarette. So stopping the nicotine is not everything that needs to be done. If we look at the effects of nicotine, the stimulant effects, it increases heart rate, increases activity in the sympathetic nervous system, stimulates adrenaline release, decreases circulation in the extremities, and this is particularly has negative effects for diabetics who already have problems with circulation in the extremities. It increases tremor, alters glucose regulation, and causes increases in the basal metabolic rate of habitual smokers, which of course is what keeps them slim. And you'll hear many people say they don't want to stop smoking because they gain weight, and I will talk a bit about that later. The effects on the brain. It acutely increases the activity in the central reward pathway. We've already seen how it works on nicotine receptors and dopamine receptors to release dopamine, the feel-good hormone. It chronically reduces brain serotonin levels. So very often when you get people coming off smoking, the low levels of serotonin kick in and you end up with a depression. Acutely increasing acetylcholine levels in the cortex. And then the psychological effects. So there is no evidence that it reduces stress. It only relieves withdrawal symptoms, and yet you'll get people who swear blind that it reduces their stress. It may increase vigilance. It increases the feeling of agitation. And of course, we do know, especially if it's somebody new that's smoking, it can induce lightheadedness and can induce nausea. And we're actually seeing this a lot more now that people are vaping. So when you smoke a cigarette, you know how many cigarettes you're smoking, and you can only inhale a certain amount of nicotine. With vaping, we're starting to see nicotine toxicity. People being admitted to ER thinking they're having a heart attack, and it's nicotine toxicity. So this is on the increase, and we're seeing it in youngsters that just vape continuously. So if we look at the amount of nicotine in a cigarette, so I already indicated that the 0.7 to 1 gram of tobacco contains about 9 to 17 milligrams of nicotine. However, much of this is lost during the process of smoking. So if a cigarette is smoked as hard as possible, a smoker can absorb to a maximum of 6 milligrams of nicotine into their system. A toxic dose of nicotine has been estimated to be about 60 milligrams in adults, and just 1 milligram per kilo in children. And of course, we're seeing poisoning where children are getting hold of the candy floss flavored vaping fluids and drinking them. So let's look at the absorption of nicotine over time. So here's a graph, and on the bottom on the x-axis is time, and on the y-axis is plasma nicotine. And you'll see with a cigarette, that is the fastest release. So as I said to you, within seconds, they get a very sharp increase, and that is at its maximum at about 10 minutes, and then it drops off quickly. So literally within 20 minutes, you're starting to get withdrawal, and this is where you start getting your chain smokers. If we look at a cigar, obviously they don't inhale as much. It's a much slower increase and a gentler drop off. And then, of course, the gray one is the pipe, and the pipe as well, they tend to puff on it slowly, and you can see the 3 graphs there. So why is it so hard for smokers to stop? Well, the answer is the short half-life of nicotine. So in order to maintain a level of nicotine in your bloodstream, and you need to be smoking regularly. And here you can see if somebody smokes at 9 o'clock, by 20 past 9, it's dropped down. They need to smoke at 10 o'clock, and you'll see the smoking continues through the day. A cigarette an hour, which is not a heavy smoker, but 1 cigarette an hour, and you'll see that the base levels of nicotine start to climb. And of course, they drop off at night. And so that you'll get somebody that is addicted, highly addicted to nicotine. The first thing they do when they wake up in the morning is they need to smoke because they are in withdrawal. These are some of the withdrawal symptoms. I'm not going to go into them in any great depth, but you'll look at the prevalence, and of course, the high prevalence. And this happens within a few hours of stopping smoking, but it's usually gone within 4 weeks. So we very often talk about a successful quit attempt is when you've stopped smoking for 4 weeks. And that's irritability and aggression. I spoke about the depression, the fact that smokers, habitual smokers, have low serotonin levels. There's restlessness, poor concentration. The increased appetite is one that occurs, and it lasts often longer than 10 weeks. And unfortunately, that's in 70% of people. So when people stop smoking, they are going to gain a bit of weight. And then they carry on there. You can see all the other things. The interesting ones are the positive effects, which of course are decreased cortisol, decreased adrenaline, decreased tremor, metabolic rate, skin temperature, but of course the increase in weight, which can on average be 6 to 8 pounds, which is what, 2 to 3 or 4 kilos, which is significant. I know my husband always says to me, if I've got a certain weight, if I'm slightly over it, I'm overweight, and if I'm just under it, I'm just right. And it's very finely tuned. Some people will say to you that they're going to try and smoke less. So why is smoking less not good enough? Well, the research shows that even just 1 to 5 cigarettes a day can cause abnormalities and increase heart risk. And with cancer, it's the duration that matters more than the dose. So a 3 times increase in the number of cigarettes you smoke a day will triple your cancer risk. But a 3 times increase in duration gives you 100 times the cancer risk. So the longer you smoke, the higher your risk. Let's talk a little bit about pharmacotherapy. So currently here in South Africa, if you're going to be looking at pharmacotherapy, there are 3 interventions that you can use. The first one is nicotine replacement therapy. Then there is varenicline. This was called Champix by Pfizer. It was withdrawn off the market after there were a few suicides that were linked to it. It has since been proven that it wasn't the varenicline causing the suicide, but that it was rather the withdrawal from the smoking. And then there's also bupropion, which is Zyban or Wellbutrin. Interestingly enough, it has got also a lot of side effects. The varenicline and bupropion are both Schedule 5 drugs. They're centrally acting drugs. Nicotine replacement therapy, on the other hand, is available over the counter. So let's look at the relative effectiveness of these different treatment options. So you'll see here, and you'll remember I told you that 60% of people want to stop smoking. And in fact, 60 to 70% of people every year want to stop smoking. 30% of them will go on to try and stop smoking, but only 3 to 5% are actually successful. And you'll see here are the relative ones. So no medication whatsoever. This would be a cold turkey quit attempt is less than 16%. With the blue is with some behavior change therapy. And then the green is group therapy. You'll see the next one is mono nicotine replacement therapy. And here you can see that there's quite a big increase. Somebody just using single NRT. As soon as you bring in combination NRT, there's quite a significant jump. We're going from 16% to 36%. That is a significance, more than double. And if we look at bringing in behavior change therapy, we are looking at a 50% success rate. And you'll see that is higher than the bupropion, which has so many side effects. And it is almost the equivalent of the varenicline, bearing in mind NRT does not require a prescription. So let's look at nicotine replacement therapy options. In South Africa, we've got gum, we've got patches, and we've got the oral mist. So let's have a look at how these different formulations work in comparison with a cigarette. The first thing to realize is that all of them contain less nicotine than a cigarette. They are not there to replace the cigarette, they are there to assist with the withdrawal. So again, you'll see the same graph with the cigarette going up to the peak and then dropping off quite rapidly. You'll see that the closest to a cigarette is the oral mist or the spray. And it's got a slower decline. If we look, the gum is this dotted line here. So the gum takes a little bit longer to start working. It has a slower increase, but it lasts much longer. And then the patch is the dashes, the dashed line. That's this one here. You see it's a baseline slowly going up, and it maintains that level over 16 to 24 hours. So let's look at the science between NRT, and this is from a Cochrane review. So NRT leads to a doubling of cessation rates achieved when compared to non-pharmacological interventions, irrespective of the level of intervention. Combination NRT is 27% more effective than single product use. NRT and gum together has been shown to help control weight gain, often experienced after cessation. The risk of dependence on the NRT is small, and in fact, it's less than 5%. But long-term use of NRT, so those 5% who find that they've swapped cigarettes for NRT, is not associated with any serious harmful effects. So let's look at the patches. The NICORETTE, made by Kenvue, comes in 3 different strengths, 25, 15, and 10. It lasts up to 16 hours. It's a discrete, once-a-day solution, and as I've already indicated, provides that steady dose of nicotine. You might be asking, well, how do I know what strength to use and how long must I use it? So if we look at the treatment program, and we are dividing it into heavy smokers and medium to light smokers. A heavy smoker would be somebody who smokes 10 or more cigarettes a day. You would start them on the 25 milligram, the strong patch. They would use a patch a day for 8 weeks. They would then drop down for 2 weeks onto the 15 milligram and then onto the 10 milligram for the further 2 weeks. It's a 12-week program. And this is important because so many people stop too early and then they end up relapsing. If you've got a patient who smokes less than 10 cigarettes a day, you can start with a 15 milligram, but it is still a 12-week program. 8 weeks on the 15 milligram, 4 weeks on the 10 milligram. Side effects, and we often get asked about the side effects of these. So less than 5% of people have a little bit of a skin reaction. So we are very careful with people with very sensitive skin. That reaction can be a rash or a slight burning sensation. Some people experience wakefulness. We know that nicotine does cause a release of adrenaline, and some have reported that it causes vivid dreams. So the top tip here is that if the treatment disrupts sleep, remove the patch a few hours before bedtime and control any cravings with gum or spray, which has a much faster escape out of the body, metabolism, sorry. And patients with psoriasis or eczema or very sensitive skin use a different product. So what are some of the other products? There's the gum. So this starts to work from the first chew. It's available in 2 strengths, a 2 milligram and a 4 milligram, and they're different flavors. And which strength should I use? So if you smoke 20 cigarettes per day or less, you can try the 2 milligram. The dosage, though, is important. The dosage is up to 15 gums per day. And research also shows that it actually is better to start on the 4 milligram and then drop down to the 2 milligram. Once again, and I must just mention this before I go on to the technique, you are again looking at 3 months treatment, and that's important, a tapering off of the gum over 3 months. A lot of people take it and they think it's chewing gum, and they chew it fast. It gives them a headache. They feel nauseous. They have reflux. It's because they're using the wrong technique and they are swallowing the nicotine. The whole idea is that you absorb the nicotine through the cheeks. So you bite into the gum until there's a strong nicotine flavor or peppermint flavor if they're peppermint gums. You then park the gum in between the cheek and the teeth to allow the nicotine to be absorbed through the lining of the cheek. You should try not to swallow your saliva at this stage because that's when you start getting reflux. Wait for the nicotine taste to fade, and then you can chew again. Common side effects of NRT gum: burning sensation in the mouth, tingling, indigestion. But as I've mentioned, if somebody's using the gum and they get indigestion, it's because they're swallowing the nicotine. Hiccups, and jaw ache. And here's a good tip, and I think this is a good one for dentists. If you've got somebody with dentures, rather use a different product, unless those dentures are quite secure, and avoid if a patient has got gastric ulcers, esophagitis, or gastritis. And then the last one, the nicotine mouth spray. So this is a spray. It comes in a very easy to use decanter. You use 1 to 2 sprays for the first 6 weeks, 1 to 6 weeks, when you would normally smoke a cigarette or have cravings. Start with 1 spray, and if that doesn't satisfy the craving, you can go to 2 sprays. And for 15 cigarettes a day, you're probably going to be using 1 to 2 sprays at least 15 times during the day. The spray is the one thing that you can use when you have a craving because of its very quick onset of action. The gum, and this is a mistake a lot of people make with the gum, is they try and use the gum when they have a craving and they'll say to you it doesn't work. That's because you need to use the gum regularly, not when you've got a craving. You'll remember that graph shows that it takes about 15 to 20 minutes for the gum to actually be effective. And by then the craving is long over, or you've already taken out a cigarette. Step 2, which is weeks 7 to 9, you reduce the number of sprays. And by the end of week 9, you should be using half the average number of sprays per day. And then step 3, weeks 10 to 12, and you'll see a pattern here. All of them are for 12 weeks. You continue reducing the number of sprays per day. And then when you've reduced to 2 to 4 sprays per day, you can actually stop using the spray. Common side effects. As with the gum, hiccups. You can have a bit of distortion of taste, headache. That generally means that you may be using too much. The nicotine is being absorbed too quickly. Indigestion and nausea. Again, if you're spraying into the back of your throat, that could be why you're swallowing the nicotine, causing the indigestion. So spray into the side of your mouth. Contraindications of NRT are hypersensitivity to any of the components of the NRT. Children, it's only recommended for individuals 18 years and above here in South Africa. Unfortunately, in South Africa, it's contraindicated in pregnancy. What I would say is if you have a pregnant person, a lady who wants to stop smoking and she needs some sort of support, ask her to speak to her obstetrician because you would be using it off-label. And in fact, it is used elsewhere in the world to help ladies stop smoking during pregnancy. And then, of course, breastfeeding. So let's bust some myths. So the first myth, and I get this very often, using NRT means I'm just replacing one addiction with another. Well, this is not the case. You're going from 4,000 plus chemicals down to 1. There's less nicotine in NRT than in a cigarette. It has a slower release, and it is a short-term use in order to help you come completely off cigarettes. And you're twice as likely to quit successfully using NRT. Another one I often get is, I only need to use NRT when I get a craving. And I've already told you why that doesn't work. If you use NRT products alone, they should be used throughout the day, and you shouldn't wait for the craving to come. You use it as a preventative, not a cure. Another one is nicotine causes the same diseases as smoking. It doesn't. It's not the nicotine in cigarettes that causes cancer. It's the other chemicals. We know the carbon monoxide causes the stickiness of the blood and the shortness of breath. And of course, the tars that cause the cancer. Nicotine is one chemical compared to over 4,000 odd in cigarette smoking. So top tip, be careful not to underdose smokers with the 2 milligram and the 2 milligram gum. The 4 milligram strength will be more likely to keep cravings at bay. And then the last one, which I've already spoken about, is I chew this like regular gum. And of course, the answer is no, we don't. And a good tip for anybody using the gum is not to drink an acidic drink like juice or coffee 15 minutes before using oral nicotine products, as it inhibits the nicotine from being absorbed. This here is comes out of this reference here that I've got at the bottom. It is a clinical review of nicotine replacement therapy. So you can see here, assessing a smoker, assess their motivation to quit. Is a smoker willing to stop quitting in the next 30 days? If the answer is no, just give advice about stopping smoking. If the answer is yes, assess the dependency on nicotine, past or anticipated withdrawal symptoms, and craving for cigarettes, irritability, aggression, anxiety, depression, poor concentration. If the answer to that is no, then you can help the smoker to stop smoking. If the answer is yes, so in other words, they have had withdrawal symptoms, offer NRT. So this comes from a clinical review. I'd like to show you a short video clip now, which is about 30 seconds to save a life.
We want clinicians to think about their relationship with patients and support them to play a more active role in managing their health and their healthcare. To help bring about this change, we need to consider what happens in the private space of the consultation room behind closed doors. In the first consultation example, the clinician and patient adopt the traditional clinician/patient roles. The clinician does use positive reinforcement initially, but keep an eye out for how they negate any positive reinforcement by using but. Ignore the patient's viewpoint by pushing their own agenda and views. Give unsolicited advice about what the patient should do. In the second, we show how the clinician adapts their questions and comments to empower the patient to make their own decisions about their health.
Your cough is bad again, Mr. Baker. When we last met, you said you were trying to give up smoking. How's that gone?
Well, I've not given up completely, but I'm not smoking much now. I think I'm doing well.
Well, that's good, but you do know, don't you, that you really need to stop smoking completely now?
Yeah, but I managed to cut down. I was smoking 30 a day, but I cut it down to 5 a day, and I feel a whole lot better for it. I can make it down to the pub now without too much trouble.
Well, that's a good start, but you must understand that any smoking is going to continue to damage your lungs. You really do need to give it up altogether if you want to help your lungs.
I know, but it's so difficult to give up altogether. That cigarette after dinner really helps me relax. I get so wound up with all that's happening in my life at the moment. It's the one thing that I really enjoy. It calms me down. And anyway, the damage is done now.
A lot of people think that smoking calms them down, but it's a known fact that smoking doesn't help you relax. In fact, it does the opposite.
Well, smoking helps me relax. And when I gave up before, I put on a load of weight, and that's not good for me either, is it, Doctor?
I understand that, but in fact, giving up smoking's more important for you right now than putting on weight. And there are other things you could do to relax. Maybe you could take up a hobby that would help distract you, like reading.
Right, I'll think about that.
There are some things out there to help you. Have you ever tried nicotine patches?
No.
Well, nicotine patches increase your chances of stopping. Did you know that? They'll really help your motivation. I can prescribe you some now. Would you like to try some?
I suppose so.
Here you are. See how you get on with these.
Now, watch the different approach in this second example of the same situation.
I'd like to get an idea about what you've been doing since we last met to stay healthy with your COPD.
Oh, well, I've been taking those inhalers the nurse showed me how to use, and I've cut down my smoking from 30 to 5 a day now.
Oh, well done. That's fantastic. How did you manage to do that?
Oh, cutting down involved a lot of willpower. But I've also been staying away from my friends who are heavy smokers because it's really difficult just to have one when I'm around them. Basically, I'm just down to the ones I really can't give up, like after meals and when I'm feeling stressed.
So you've done really well in cutting down, and you feel that the 5 a day are the ones you need the most. Tell me a bit about what's good about smoking them.
What's good about smoking them?
Yeah, what's good?
I just need something to finish off the meal. It helps me with my appetite as well. When I tried to give up smoking before, I put on a lot of weight, and it relaxes me. When you've got as much stress as I have in your life, you just need something to help you calm down.
Yes, I can really understand that stress can be difficult to deal with and that you'd rather not put on any weight. If I was to ask you on a scale of 0 to 10, where 0 is not at all important and 10 is very important.
Sorry about that.
How important would it be to you right now to have a go at giving up altogether?
Giving up altogether?
Yes.
About a 6.
6. So what makes it a 6 and not a 4 or a 5?
Well, it's a 6 because I know it's not good for me. My daughter's worried about me. I have to hide the ciggies when she comes round because she gives me a hard time. And I don't like the grandchildren seeing me smoking. It's not a very good role model, is it?
I can see that it's difficult. On the one hand, you know that it's continuing to damage your lungs. Your family is worried about you, and you don't want to be a poor role model for your grandchildren. On the other, you really enjoy those few cigarettes you have now. They relax you and help you control your appetite.
Yes, that's right. You know, I'd really like to see that nurse who helps people stop smoking. I'd like some support to help me just crack the last few a day. I think I can do it.
Well, I'll arrange that, shall I? That sounds like a plan to me.
Yes, please do. I know I can manage it. Well, thank you, Doctor.
So, interesting how the different way you approach it can affect the response from the patient. So, we all like to tell patients about the negatives of smoking, but of course they know that. Every time they buy a packet of cigarettes, there's a picture of lungs full of black tar on them. So we don't need to tell them about the bad effects. What we should be looking at are the benefits. And the benefits happen almost immediately. Within 20 minutes of stopping smoking, your blood pressure already starts to drop to normal. And I'm going to just show you another little video about the benefits of stopping smoking.
You know that smoking is bad for your body. You also know that the longer you smoke, the worse it is for your body. But what you may not know is how good it is for your body to quit smoking, and that the longer you go without smoking, the healthier your body becomes. After only 20 minutes from your last cigarette, your blood pressure, pulse rate, and the temperature of your hands and feet all return to normal. After 8 hours, the nicotine in your bloodstream reduces by 93.25%. After 12 hours, your blood oxygen level increases to normal, while your carbon monoxide level drops to normal. After 24 hours, your quitting-related anxieties peak and will return to pre-quitting levels within 2 weeks. After 48 hours, damaged nerve endings are regrowing, and your sense of smell and taste are returning to normal. At this time, your quitting-related anger and irritability peak. After 72 hours, you are 100% nicotine-free. Your withdrawal symptoms already peaked, the bronchial tubes in your lungs are relaxing, and you're now breathing easier. After 5 to 8 days, you're having an average of 3 cue-induced cravings each day, and no craving lasts longer than 3 minutes. After 10 days, you have less than 2 cravings a day, each less than 3 minutes. After 2 weeks, the blood circulation in your gums and teeth are similar to a non-smoker. After 2 to 4 weeks, your quitting-related anger, anxiety, impatience, insomnia, restlessness, and depression are gone. After 2 weeks to 3 months, your risk of heart attack is dropping and your lung function is improving. After 3 weeks to 3 months, your circulation is improved, your chronic cough disappeared, and you are walking easier. After 9 months, your sinus congestion, fatigue, and shortness of breath are decreased. The cilia in your lungs, which keep your lungs clean, are regrown, and you have increased energy. After 1 year, your excess risk of coronary heart disease, heart attack, and stroke are now half the excess risk of a smoker. After 5 to 15 years, your risk of having a stroke is the same as a non-smoker. After 10 years, your risk of lung cancer is 30 to 50% of a smoker's risk. Your risk of death from lung cancer is reduced by half, and your risk of pancreatic cancer is the same as a non-smoker. Your risk of mouth, throat, and esophagus cancer is also reduced. After 13 years, your risk of tooth loss is the same as a non-smoker. After 15 years, your risk of coronary heart disease is the same as a non-smoker. After 20 years, the risk of death from smoking-related causes is now that of a non-smoker. Good as new. Learn how to quit smoking.
So, you can see the benefits there. I'm now going to take you through Stoptober, which is the campaign in October. October is Stoptober, and it starts today. So it is your time to quit smoking. This is the message that we're putting out to the public. So it is a 28-day smoke-free challenge. Quitting smoking is one of the single most important steps you can take to improve your health. And just 28 days smoke-free means you're 5 times more likely to quit for good. The call to action is, whether you've tried before or this is your first attempt, Stoptober is the perfect time to start. With the right support, quitting is possible, and your local ICPA pharmacy is here to help. What are the objectives of the campaign? Well, it's to challenge South Africans who smoke to quit for 28 days during October. It's to alert smokers of the benefits of stopping smoking. It's to ask clients and patients about their smoking status. I've already mentioned that they expect you to ask. Highlight the risk, the link between tobacco use and heart disease. And for us, it's to promote the role of the pharmacist in smoking cessation. So we've got something called Train the Trainer initiative. So pharmacists typically see patients with chronic conditions 12 times a year. They fetch their prescriptions once a month. That's 12 opportunities to ask about smoking status, 12 opportunities to start the smoking cessation conversation. It's the ideal setting for smoking cessation services, as many pharmacies have got primary healthcare clinics with nurses. So we started training. The training we have is based on the NCSCT program, which is a smoking cessation training program from the UK. It is open source, and it's what the National Health Services, or NHS in the UK, uses, where they refer their smoking patients for smoking cessation services to community pharmacies. And we are expanding this across South Africa. So the idea here is that we include all healthcare practitioners with the same message, which is ask about smoking status and offer help if the person is thinking about stopping smoking. So what is a brief intervention? And I'm going to be talking about what a dentist or an oral hygienist can do in terms of a brief intervention. So a brief intervention or advice, it takes a few minutes during a routine interaction, and it should be given to all tobacco users. In a clinical setting, it is feasible, effective, and efficient, and it can have a significant impact if it's delivered routinely and widely across healthcare systems. So it is called VBA, very brief advice, and it's the 3 A's: ask, advise, act. So ask and record the tobacco use status of your patient. Advise them on the most effective way of quitting. And we've already heard that it's with support and with some sort of nicotine replacement therapy or pharmacological support. And act on the patient's response. If they indicate they are willing to stop smoking, then refer them to your pharmacy, to their GP, wherever it is they need to go. Let them go and get that support. So this video here, it's my last video for the night, so after this you can put your popcorn away, is about 30 seconds to save a life.
Cut up.
It's been 18 months since Lisa's husband Tom died. She misses him every day of her life.
So.
Thanks, Nurse. That's Nurse Sophie. She's taking really good care of Dad.
After being diagnosed with lung cancer, Tom spent 4 months in and out of hospital undergoing chemotherapy.
I love you.
Before being diagnosed, Tom spent many months coping with a worsening cough and sharp chest pains. He tried several times to stop smoking on his own,
No, I'll pass.
but never succeeded for more than a few weeks at a time.
Well, I've prescribed you some naproxen.
Yet all of this could have been prevented years before the cancer had even started, with just 30 seconds of his GP's time at a consultation about a wrist injury.
Bye for now.
30 seconds is all it would have taken to follow 3 simple steps. Ask,
Okay.
advise,
Bye for now.
and act.
Oh, Mr. Jackson, are you still smoking?
Yes, I am, unfortunately. You know, with the new baby, I'd love to...
First, ask your patients and establish and record their smoking status.
It's really stressful. And,
This won't spoil your relationship. Most patients expect to be asked and are happy to talk about it. Next, advise.
Well, listen, obviously the choice is entirely yours, but we now know that the best way to stop smoking is a combination of support and treatment, which are available on the NHS.
Advise them that the most successful way to stop is with NHS support and medication.
You're not just doing it on your own. Do you think that's something that might interest you?
And finally, act. If you have an in-house stop smoking advisor, suggest they make an appointment.
We have a nurse here who is an expert in helping.
Alternatively, refer them to the local stop smoking service where they can receive specialist support.
Do you want to make an appointment?
Yeah, why not?
Good.
Let's do it.
Brilliant.
Okay.
Okay, well, you let me know how you get on.
Thanks.
All right.
Bye-bye.
Bye-bye.
It's never too late to change someone's life.
An appointment tomorrow at 9:30.
Health professionals are listened to in a way that's unique. 30 seconds is all it takes to ask, advise, and act to inspire someone to stop smoking for good.
Liam?
30 seconds is all it takes to transform someone's future.
Definitely food for thought. So the next thing that we would do after the very brief advice, I'm going to take you through what would happen on the 28-day Stoptober smoking cessation challenge, is we would assess the readiness of a smoker to attempt to stop smoking. So ask the patient about their smoking status, identify the smokers, and then check whether they are motivated to stop smoking. So on a scale to 1 to 5, where 1 is motivated, not motivated at all, and 5 is highly motivated, how motivated are you to stop smoking right now? So here you see is the motivation, 1 to 5, and then confidence. So again, on a scale of 1 to 5, how confident are you that you could stop smoking right now? If you find that that person falls within the dark green, they are definitely candidates to be referred immediately. The pale green and the yellow, they may be lacking a bit of confidence or they may be lacking a bit of motivation. Be guided by what the patient says. The ones in red, those are the ones where you just give advice and you'll probably ask them again when they next come for the dental appointment, are you still smoking? And they'll say, yes, they're still smoking. So you can see here, those that want to stop smoking should be assessed then for their nicotine dependence. So they've said they want to stop smoking. They come in. We now assess the readiness of smokers their nicotine dependence. Let me go to that. That is the Fagerstrom test for nicotine dependence. It is 6 simple questions. This is a clinical tool used to test nicotine dependency, and it looks at items such as how soon after you wake up do you smoke your first cigarette, and then you score. So you can see there your highly addicted people, because their nicotine levels are low following a whole night without cigarettes, they're going to smoke within 5 minutes and they'll score a 3. So you put the 3 down there. You then look at questions like, do you find it difficult to refrain from smoking in places where it's forbidden? Which cigarettes would you hate the most to give up? How many cigarettes per day do you smoke? Do you smoke more frequently during the first hours after awakening than the rest of the day? And then the last one, do you smoke even if you are ill and have spent most of the day in bed? You then add up the score and you get an interpretation of the scoring. So this is the percentage of smokers on the y-axis, and these are the points. So your extreme nicotine dependence, they're going to be scoring an 8 to 10. They are a small group, and the chances of giving up are very small. The withdrawal symptoms can be debilitating. The ones that we would probably be targeting are where the most people fall, and that is the average to above average. So in other words, scoring up to 5. And you'll see there's the low dependence. They'll have few and light withdrawal symptoms. The 2 to 3, they'll have a certain degree of dependence. They may have some difficult withdrawal symptoms. And then the over average or above average, there the withdrawal symptoms are common and the risk for smoking related disorders is real. So that's how we would interpret it. And depending on their dependence on nicotine would really dictate which way we would guide the person to choose what sort of pharmacotherapy would best suit them. Important to note as well is that there's a variety of different NRT products, and to tailor them to suit the patient. As I've already indicated, some people won't want the gum. Some people may not want a patch. So we really do tailor the pharmacotherapy to suit the patient. We then tell the patient to calculate their financial benefits. So here's a savings calculator. So you smoke a pack of 10 cigarettes, which cost 27 Rand a day. If you smoke 20 a day, that's 54 Rand a day, and you can see how quickly the costs go up. So we would be saying to them, what are you going to do with the extra 1,620 Rand that you'll have at the end of this month if you stop smoking? Next, we would look at the WHO cognitive behavioral therapies. And what I wanted to focus on here is dealing with cravings in particular. So you heard in the video about the benefits of stopping smoking, that they're going to have, on average, 3 cue-related with cravings for a cigarette every day, but that each one of those cravings only lasts 3 minutes. And so what we do say to people is use the 4D strategy to deal with those cravings. And those are delay, deep breathing, drink water, or do something else. You need to distract yourself just for 3 minutes to get over that withdrawal. We will have in our pharmacies a tar jar. So there's a tar recipe there, which was sent out to all our pharmacies. But graphically, this represents the amount of tar in tobacco smoke, and helps to explain to smokers what causes the cancer, the bronchitis, and the emphysema. An average of 15 to 20 a day smoker takes about a mug full of this sticky tar into their lungs every year. And very often, just the seeing that jar has been enough to motivate somebody to try and stop. It's an excellent visual aid. So what is Stoptober? It's an individualized 8-step plan. So step 1, and this is somebody who wants to stop smoking, set a quit date, agree on a date. Step 2, plan what to do with your savings. Step 3, focus on your reasons for wanting to quit. And that's important. And it could be different. I had one lady where she was not going to stop smoking because she had children in the house. It turned out that she had a little Maltese poodle who had asthma. And the vet had said to her that probably her smoking was what was aggravating the dog's asthma. And that was the reason for her to stop smoking. So don't judge her. She stopped smoking, which obviously benefits the children as well. Identify and manage triggers. You saw the man in the 30 seconds to save a life. His trigger was being at that braai place with his friends. And that's when he was offered the cigarette. Decide on the medicine to manage your withdrawal symptoms. Step 6, build a support network. Important to have a buddy or somebody that you can talk to when you do have those moments of weakness. Step 7, learn healthier ways to manage your triggers. And then step 8, stick to the plan. Thank you, everybody. And remember, helping one person might not change the whole world, but it could change the world for one person. And those are my references.
Thank you so much, Jackie, for that incredibly insightful presentation. We will now open the chat box for questions, ladies and gentlemen. So if you do have a question for Jackie, please feel free to click on the chat icon at the bottom of your screen and type your question into that chat field, and then we will read it out. Jackie will then do her best to address the questions with the depth and the clarity that she's known for. Can I just ask that as we move through these question and answers, that we keep them brief and focused so that we can hear from as many of you as possible. And then I will read them out as soon as we get any.
It's a lot of information, Elani, so I won't be surprised if everybody's just a bit stunned. Okay, so I do
So
see a question there.
yes, here's the first question. Can you send a list of pharmacies that we can refer to, please?
Okay, certainly we can, but what I can say is that nicotine replacement therapy, which I've indicated is Schedule 1, Schedule 0, and Schedule 2, so in other words, pharmacist-initiated therapy, a patient or a smoker can get it from any pharmacy. So you can refer them to any pharmacy. What we will be doing is in our public media statements, we do have certain pharmacies that now have smoking cessation practitioners. And we're starting to build that up. As I indicated, one of the problems, one of the challenges we've got here in South Africa is we don't have a framework that is recognized by the funders. So that's our biggest challenge at the moment is we're busy talking to Council for Medical Schemes to try and get it as a PMB because we really should be supporting people who want to stop smoking. But I think right now, safe to say, you can refer them to any pharmacy. They will be given support in terms of the NRT there.
Thank you. Any other questions?
I was really pleased to see, Elani, that 2/3 of the dentists routinely ask about smoking status. And I think that's why when I was doing a little bit of the research, seeing some of the oral cancers that people see and the fact that they lose teeth and the receding gums and those negative effects of smoking. So I think the dentists are doing far better than the pharmacists and the doctors. We're really having to do a lot of training and education around getting our practitioners to routinely ask those questions.
Yes, agreed, Jackie. Definitely encouraging statistics to see. I think we'll give another minute or two for questions.
So maybe I can ask you, Elani, while we're waiting to see if there are any other questions, availability of your products. Are they readily available? I know that there was a time where we were struggling to get patches. It was a good few years ago, but are all your products available?
Yes, we do have all the different SKUs and strengths available in both corporate and independent pharmacies. So Clicks, Dischem, and then all of the various different TLCs or independent groups. There are no stock issues or challenges at this
Fantastic.
stage. So if any of the pack sizes, for instance, what we do see is that sometimes there will be a gum pack size of the 105s and not the smaller size, or there will be one or two of the patches as opposed to all three options. And as you rightly mentioned earlier, that there's such patient intervariability, and the therapy has to be so tailored to the patients that it is definitely necessary to have all of these SKUs available on shelf. So that is perhaps the thing that sometimes are a bit more challenging, especially in the smaller pharmacies where shelf space becomes a challenge. But based on stock availability, absolutely available. Should a patient be referred to a pharmacy and there isn't the various or the relevant SKU that they are looking for, and pharmacy can absolutely order.
Yeah, no, 100%. I think, that's the important thing is that you set a quit date. People need to prepare for that quit date. So if somebody comes in and says, I want to quit today, generally I will say, okay, let's first prepare for a quit date. Let's set a proper quit date. I don't recommend they start immediately. You want to work on that motivation, but they need to do things like get rid of all the cigarettes in the house, all the lighters, anything that in that moment of weakness, they can, go and pick up that cigarette. So it does take some planning. Elani, one of the things that Kenview has got is a very nice stop smoking diary. And I wonder, if any of the dentists would like to have some maybe in their practices, could they contact you for that? because I think it's a brilliant quit smoking diary, and it is part of the support that we recommend.
Thank you for that, Jackie. We appreciate it. And you're right, it's a 12-week quit guide that we provide. It is actually available electronically as well. So if you have access to EM Guidance, to the EM Guidance platform, if you go on to NICORETTE, so when you search, you can simply search, type in NICORETTE, and then scroll down, and then from there, anyone will be able, any HCP is able then to share the quit guide, the digital quit guide to the patient or to whoever you would like to share it to. Yeah.
I'm glad I asked that, because I didn't know that. Thank you, Elani.
I unfortunately don't see any other questions. So I do see another something pop up. Let me just double check there. Cost. Sorry, there's a few different places. So there's two questions. For all the info on cigarettes, do you have adverse effects of vaping since it's Stoptober?
Absolutely. So there's EVALI, which is something that happened when vitamin A acetate was an ingredient in the vaping liquid, which actually caused this popcorn lungs. And there were a few deaths in the States. So they did identify what was causing that. So we recently presented to the Portfolio Committee on Health on vaping, because at the moment, there's no regulation around vaping. We have no idea what are in those liquids. And interestingly enough, some research was done, and the vaping liquids that say they've got no nicotine in them, 80% of them did have nicotine in them. And our biggest concern around vaping is it's the youth. They're seeing it as less harmful than smoking, which it is, but it's not harmless. So vaping, we also see cancers. We're seeing this popcorn lung, or EVALI as they call it. We are seeing problems with addiction, as I've already mentioned, nicotine toxicity, people ending up in hospital because the solutions can be quite strong. There is no regulation whatsoever. So, you're buying it from somebody who could be mixing it in their garage. You have no idea. And that's what we'd like, is just some regulation around vaping, so that we do know what is on the label is what is in the liquids. And I think long term, we don't know what propylene glycol, which is the main diluent, causes to lungs. Because, people, they suck on it like a dummy. They use it all the time. So for a smoker to go from smoking to vaping, that is a harm reduction, and we support that. Our problem with vaping is that de novo people are starting, and they're starting on vaping, and then they get hooked onto the nicotine. And then, so we're going to have a whole new generation of people on nicotine. Sorry, my cat's coming to say hello.
My dog tends to do that when I've spoken
apologies,
long
my
enough
dog.
long enough to not to her. My dog then pops up to say hello. All right, then another question just on cost. I'm wondering with this specific it just says costs. John, if you perhaps just want to clarify, what cost are you referring to? Would it be for the 12-week program? Is it to visit the pharmacy? Is it perhaps the NICORETTE options?
So what we can say for the Stoptober, there's no charge. This is a campaign that we're driving. It involves the very brief advice, the 8-step quit plan. There's no charge. The campaign, it is a campaign to bring awareness about the benefits of stopping smoking and trying to get people on their own volition to stop smoking for 28 days. And that might include nicotine replacement therapy. Obviously, there is a cost to that. I know that we did a study, and you saw there that somebody smoking 20 cigarettes a day is going to be spending close to 2,000 Rand a month. And the NRT is not as expensive as that. So the actual smoking cessation service, that we haven't properly costed out yet. We're still in negotiations with the funders there, but the Stoptober campaign, there's no charge.
I trust that answers your question then, John. Thank you. Yes, it answered his question. That's fantastic. Are there any other questions from the floor?
Probably everybody wants to had a busy day and want to
Well, I
relax.
can tell you most of the people are still online and with us, so it's been an incredibly insightful talk. Thank you very much for that, Jackie. I don't see any other questions at this stage. I think if there's any questions, you are welcome to reach out to Marlies or PR at SADA, and we can ensure that the questions are answered. So with that, then I thank you all so very much for joining us this evening. A special thank you again, Jackie, to you for sharing your expertise and sharing your passion for smoking cessation and for community health. Your insights have really truly enriched our understanding of smoking cessation and the role that we can play during Stoptober, but also during the year, right? Thank you, everyone. We
Absolutely.
appreciate your engagement. We appreciate your questions. And let's continue to support healthier choices and empower patients on their quit journey. Wishing you a restful evening and a good night. Thank you.
Thanks, everybody. And thank you to all the dentists out there. You do a fantastic job. Cheers, Elani.
Thank you, Jackie.
And thank
Go
you to
well.
SADA. Cheers.